Hi, my name is Dan Fulton. I'm the infectious disease doctor here in Ames. I work at McFarland Clinic and then also at Mary Greeley Medical Center. And I wanted to talk today a little bit about what's been going on with COVID-19. I think most people are pretty familiar with the big picture of COVID-19. I think what I wanted to share today is that here in Iowa we are really seeing what I would call a surge in COVID. We've had little blips along the way, and different pockets of the community had different risk factors, and they may have gotten exposed or gotten COVID, and that's been going on now for over 6 months. But we're really seeing a transition point or an inflection point in how much COVID we're seeing here in the community, and we're seeing that many people are now becoming infected. And I think about this like a simmering pot of boiling water, and it just feels like we were simmering for a while and COVID was around, but just simmering, and it feels now like we've reached a boiling point, and even in some ways we're starting to feel like things are boiling over. Going back, we made all this effort back in March to do what we could to bend the curve of COVID down. We did that by physically distancing from the people we love, by the kids staying home from school, by washing our hands, by wearing masks. So many things were canceled. And I think because we did all of those things, we really didn't see a huge COVID outbreak last fall. And that is a testament to all of the hard work that everybody did in the community. That is hard work, and I think people are getting tired or are tired of doing a lot of that. I'm here today to say that I think we need to rededicate to doing what we can, because right now COVID-19 is really skyrocketing in Iowa and in our community. The barometer for me is the hospital, what's going on in the hospital, and we have seen over the past 2 weeks a dramatic increase in how much COVID-19 we have in the hospital. Our number of COVID patients has now exceeded the COVID-19 unit that we had developed to take care of people with COVID-19, and it has also exceeded our COVID-19 intensive care unit area. We still have beds to take care of patients, but what we're feeling is that COVID-19 is starting to encroach upon our ability to care for the community. And I would view that as that notion of boiling water. It's just, there's a lot of COVID, and what I want to do is try to encourage folks in the community to really focus back on how do we prevent this virus from spreading. Right now, our best practice for preventing spread is all of those hygiene things that we learned about back in March, which are washing your hands, physically distant from other people, wear a mask if you absolutely have to be in public. Masks definitely work to prevent and decrease transmission. I think if we are able to do those things together, we can bend this curve back down so that we're able to get this pot to not overflow and to get back down to a simmering level. I think there's hope on the horizon. I think the vaccines that we are seeing developed, we got some good news today that one of the vaccines looks like it might be 90% effective. We need to see more data. We need to see the safety data and how it will work. But I do feel like there's a light on the horizon if we can just buckle down and get through this together. A few examples of things that I've seen are people have developed their bubbles of trust. They're bubbles of people that they know are generally kind of taking the same precautions they are, maybe. But we are seeing spread amongst people that trust each other because they start to assume, well, I know you must be okay, and there's no way you could infect me, and yet we're seeing transmission happening in the community, in homes, amongst people that trust each other. That raises a lot of really challenging questions about what we should do. How do we physically distance? And it's hard to say, do this, don't do that. But I do think if we think about the things that we know are high risk, such as indoor activities together, any indoor activity that you do that doesn't involve full masking all the time, anything that's close and people packed together, those are going to be high-risk activities. I can say personally that I don't think that we're going to be doing our usual holiday gatherings with my family, which is really hard because we haven't gotten to do big family gatherings in a long time. But when we think about, trying to protect people in our family that are vulnerable, and knowing that I do think that there's this light on the horizon of a vaccine that really will work, it seems like at least this year that makes the most sense for us. I've said from the beginning that with COVID-19, it's all about thinking about what you value. And so, some activities matter, and they matter a lot to people, and they should think about, what personal risk are they willing to take when it comes down to that? And is it worth it to potentially get infected for that activity? But I would also bring in, kind of another level of thought at this point, since we are seeing this pot boiling at this point, that we need to be thinking about this from a civic and a community standpoint too, and how do we protect people in our community that are vulnerable, not just about our own personal risk, but the risk of the community in general. And if the hospital is, full and overflowing with patients, that also affects people that don't have COVID. That affects people that have heart issues and cancer and different non-COVID related conditions that they can't control. So I think as a community, we need to come together. We need to rededicate ourselves to taking what actions we can take, to controlling what we can control, and hopefully get this curve bent back down in a direction where it's at least manageable. The clinic and the hospital remain active in terms of caring for patients with COVID. We remain active in research in terms of trying to find new ways of doing things better. And we do have a lot of the treatments that are available to care for people that have COVID. But at the end of the day, it's a challenging disease. It's a disease that when people end up in the hospital, they're here a long time. And because of that, we're seeing the numbers in the hospital grow at a rapid rate over the last 2 weeks. So, all that to say, I think my hope for the community is that if people can circle back, remember how we were in March and how much energy we had to do this right, and if we can reapply that energy now, it could make a big difference and save a lot of lives.